Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Birth defects. Introduction. A birth defect is a problem that happens while a baby is developing in the womb. About 1 in every 33 babies is born with a birth defect. The causes of most birth defects are unknown. A birth defect may affect how the baby's body looks, works, or both. Birth defects can vary from mild to severe. This program explains birth defects. It covers types and causes of birth defects. It also talks about diagnosis, treatment, and prevention. What are birth defects? Birth defects are problems that are present when a baby is born. Sometimes they are called congenital abnormalities. Congenital means present from birth. Birth defects can affect almost any part of the body, such as the heart, brain, mouth, or feet. Birth defects may affect how the body looks or works. Some birth defects may affect both appearance and function. Birth defects can vary from mild to severe. The well-being of each child that has a birth defect depends on which part of the body is involved and how severely it is affected. The lifespan of a child with a birth defect depends on how severe the defect is and what body part is affected. Some birth defects lead to death. Other birth defects can cause intellectual and developmental disabilities, physical disabilities, other health problems. Types of birth defects. There are thousands of different birth defects. Common birth defects include cleft lip and cleft palate, congenital heart defects, Down syndrome, spina bifida. Cleft lip and cleft palate are both birth defects that happen when a baby's lip or mouth doesn't form properly. This can cause problems with feeding and talking. It can also cause ear infections, hearing loss, and dental problems. A congenital heart defect is a problem with the structure of the heart that is present at birth. These defects are the most common type of birth defect. They can disrupt the normal flow of blood through the heart. Heart defects may not be diagnosed until later on in childhood. Down syndrome is a genetic disorder that causes mental and physical disabilities. People with this syndrome may also have other health problems, such as heart disease and hearing problems. Every person born with Down syndrome is affected differently. Spina bifida happens if the spinal column of the fetus doesn't fully close during the first month of pregnancy. This can damage the nerves and spinal cord. Some people with spina bifida need assistive devices, such as crutches or wheelchairs. They may have learning difficulties and other health problems as well. Other birth defects include clubfoot, fetal alcohol syndrome, muscular dystrophy. Clubfoot is a common birth defect that affects 1 in 1,000 babies. The term clubfoot is used when a baby is born with one or both feet twisted inward and pointing down. Clubfoot is not painful. Early treatment can correct almost all cases of clubfoot. Fetal alcohol syndrome is caused by drinking alcohol during pregnancy. Problems that may be caused by fetal alcohol syndrome include behavior problems, intellectual disabilities and learning disorders, physical deformities, vision problems. Muscular dystrophy is a group of more than 30 inherited diseases. They cause muscle weakness and muscle loss. Most people with muscular dystrophy eventually lose the ability to walk.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes of birth defects. Different birth defects have different causes. For many birth defects, the cause is unknown. Some possible causes of birth defects include genetic problems, chromosomal problems, exposure to certain medicines or chemicals during pregnancy. Genes tell the body to make certain substances. Every person has thousands of genes. One or more genes might have a mutation or change that causes them not to work properly. A gene or part of the gene might also be missing. This can cause genetic disorders. Genes are found on chromosomes. Each person has 23 pairs of chromosomes. In some cases, a chromosome or part of a chromosome might be missing. There may also be other chromosomal changes. For example, a person with Down syndrome is born with an extra copy of chromosome 21. Some birth defects result from exposure to medicines or chemicals during pregnancy. For example, alcohol abuse can cause fetal alcohol syndrome. Infections during pregnancy can also result in birth defects. Diagnosis. A birth defect can be found before birth, at birth, or any time after birth. Some birth defects are easy to see. Examples of these birth defects include cleft lip and clubfoot. These birth defects may be diagnosed at birth. Other birth defects are found using special tests. Examples of these birth defects are heart defects or hearing loss. Some birth defects may be diagnosed before birth using tests such as ultrasound, amniocentesis, chorionic villi sampling or CVS. An ultrasound uses sound waves to make a picture of your baby inside the womb. It can help your healthcare provider view your baby's growth and development. A special test called an amniocentesis may also be used to see if your baby has certain birth defects. For this test, a small sample of amniotic fluid surrounding the baby in the womb is taken. The fluid is then checked for birth defects and genetic problems. Your healthcare provider may recommend CVS if you are older than 35 and have a family history of genetic disorders. CVS is used to find genetic problems like Down syndrome. A small sample of placenta is taken for testing. Some prenatal tests come with risks to the mother and the baby. Make sure to talk to your healthcare provider about these risks. Other tests may also be used to diagnose birth defects after birth. Tests that may be done include echocardiogram, which is an ultrasound of the heart, hearing tests, X-rays. Newborn screening is also used to diagnose some birth defects. Newborn screening is a process that tests infants' blood for different health conditions. Treatment. Treatment for birth defects depends on the type of defect and how severe it is. Some birth defects, such as mild heart defects, may not need treatment. Treatment for birth defects may include medicines, surgery, other medical treatments. Medicines may be used to treat heart defects in some cases. Certain symptoms caused by birth defects may also be controlled with medicines. Surgery may be needed to treat many different types of birth defects, including cleft lip and cleft palate, clubfoot, serious heart defects, spina bifida, other physical problems. Other medical treatments may also be needed to treat some birth defects. Some of these treatments may include assistive devices such as crutches or a wheelchair, counseling, physical therapy, speech and language therapy. Many birth defects can be diagnosed while the baby is still in the womb. This lets healthcare providers treat or even correct some problems before the baby is born. Talk to your healthcare provider to learn more about treatment options for a specific type of birth defect. Prevention. Some birth defects can be prevented. Taking folic acid during pregnancy can help prevent certain birth defects. Folic acid is a B vitamin. Our bodies use it to make new cells. If a woman has enough folic acid in her body before and during pregnancy, it can help prevent some birth defects. Women who may become pregnant need 400 micrograms of folic acid every day. Before trying to get pregnant, talk to your healthcare provider about the medicines that you take. Some medicines can cause serious birth defects. Do not drink alcohol, smoke tobacco, or use drugs during pregnancy. Exposure to these chemicals can harm the baby and cause birth defects. Make sure all of your health conditions are under control before you become pregnant. Some conditions may increase the chances of birth defects, such as obesity or uncontrolled diabetes. It is also important to try to prevent infections while pregnant. The best way to do this is to wash your hands often. To prevent infections during pregnancy, you should also avoid contact with cat litter, cook meat thoroughly, stay away from wild animals and their droppings. Talk to your healthcare provider about vaccinations.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A birth defect is a problem that happens while a baby is developing in the womb. Most birth defects happen during the first 3 months of pregnancy. A birth defect may affect how the baby's body looks, works, or both. Birth defects can vary from mild to severe. Some birth defects are easy to see. These birth defects may be diagnosed at birth. Other birth defects are found using special tests. Different birth defects have different causes. For many birth defects, the cause is unknown. Some possible causes of birth defects include genetic problems, chromosomal problems, exposure to certain medicines or chemicals during pregnancy. Many birth defects can be diagnosed while the baby is still in the womb. This lets healthcare providers treat or even correct some problems before the baby is born. Treatment for birth defects depends on the type of defect and how severe it is. Some birth defects, such as mild heart defects, may not need treatment. If a birth defect requires treatment, it may include medicines or surgery. It may also include assistive devices, such as crutches or a wheelchair, counseling, physical therapy, speech and language therapy. Some birth defects can be prevented. You can take steps to prevent birth defects by avoiding alcohol, tobacco, and drugs, controlling any ongoing medical conditions, preventing infections during pregnancy, taking folic acid. Thank you for using Explain.